Hi, my name is Dominic Akotowa. I'm the Chief Resident of the Internal Medicine program here at Navicent Health, and I'll be your host during this overview of our residency and our infectious disease fellowship program. Along the way, we'll take you to many of the places on and off campus where you'll spend most of your residency. We will also answer some of the common questions you have, like why should you train here, and how this program will prepare you for the career that you want. In a few minutes, our program director will give you a great introduction to our internal medicine residency program. Then, our department chair will give you more details about the program. I'll also be taking you on a virtual tour of the facilities where you'll be doing most of your training. Along the way, you'll hear from other residents about their resident experience as well. We'll also learn about our 2-year infectious disease fellowship program, and you'll hear from a recent fellow as well. We hope this video will give you a good introduction to our residency and our fellowship programs, and will encourage you to apply. So let's dive in. Why should you train at Navicent Health? As a resident here, you'll have the best of both worlds. A community-based residency experience combined with the advantages of a well-regarded academic residency program. Residents get a broad exposure to internal medicine practice in both the inpatient and ambulatory settings, preparing them for a great career in internal medicine. You'll have excellent education, mentorship, and the support that you need in order to deliver the best care possible for your patients. Here, you can reach your full potential. If you're interested in something, our faculty will mentor you and provide you with excellent opportunities. Even though the internal medicine program here is rigorous, we still have downtime to do the things we love. I really enjoy working out, and I'm also learning how to play golf. You actually caught me on the way to the Employee Fitness Center. Go ahead and meet up with Dr. Mathis in the Eversole Auditorium. We'll catch up afterwards.
Thank you for joining us today. My name is Dr. David Mathis, and I am the Director of Internal Medicine Residency Program at Navicent Health. Our program offers the breadth of knowledge you need for a great career in general internal medicine, blending academic research opportunities with Mercer University School of Medicine with the individual attention and patient mix of a good community-based medical residency. We have been fully accredited by the ACGME for over 3 decades. Our goal is to produce confident, highly competent internists comfortable in whatever direction they choose to go, from the primary care office or into the ICU. During your 3-year residency or 2-year fellowship, you'll spend about 60% of your time working at Georgia's second largest hospital, the Medical Center at Navicent Health, where you'll work as a hospitalist on the general floors and in the ICUs. And you'll spend about 40% of your residency training in the outpatient setting. As a resident, you'll be able to tailor the program to your career goals and fine-tune your subspecialty skills with a rich elective program while covering all of the fundamentals of general internal medicine. During a typical day, you'll get daily scheduled learning opportunities such as grand rounds, M&M, core conferences, journal clubs, tumor conferences, board reviews, and daily morning reports. Year after year, our residents enjoy postgraduate success with over 90% board passage rates and placement into prestigious fellowship programs, including pulmonary critical care, cardiology, endocrinology, nephrology, rheumatology, GI, and others. Now, I don't have to tell you that medicine is a stressful career. That's why our amazing faculty and staff are totally committed to providing you with the teaching, mentorship, one-on-one training, and support to build your competency and your resilience for a long and successful career. And we have a family-oriented culture where we have each other's back. We take individual responsibility and show mutual respect for our colleagues. Now, I'd like to introduce you to our department chairman, Dr. Jeffrey Stevens.
Thank you, Dr. Mathis. My name is Jeff Stevens, and I serve as Professor and Chair of Medicine here at Navicent. I'd like to talk to you a little bit more about our program and the experience of living here in Macon. I think we have the best of both worlds here in Macon. We have a large, vibrant teaching hospital in the community, a dedicated faculty who are very well trained and are committed to teaching. One of our real strengths is the esprit de corps. You're not a number here. You're part of a team. You're part of committed faculty. Our residents find that they are able to compete for fellowships and succeed and excel in internal medicine disciplines, both in academic programs, in private practice, and as hospitalists. Many of our faculty have hidden talents. They play the guitar, they dance. I'm not allowed to dance or sing, so that tells you something, but we like to see people have a good time. Thank you again for your interest in our residency program here at Navicent. I'll turn things back over to Dr. Mathis, who is probably tap dancing his way to the camera as we speak.
Thank you, Dr. Stevens. When you have the buy-in and support of top leadership like we do, the clinical and academic environment is able to flourish. One question that is probably on the top of your mind is, what do the facilities look like? We'd like to show you around the campus so you can see the inpatient and outpatient settings where you will be practicing during your internal medicine residency or infectious disease fellowship here. I'd like to turn you back over to Dr. Okedawa to give you the royal tour of the key facilities.
Thank you, Dr. Mathis. Let's take a bird's eye view of the campus and a look inside some of the most important facilities to the internal medicine program. Navicent Health is a large and comprehensive health system with over 1,000 beds, including over 630 licensed beds at our primary hospital, the Medical Center, which is the tertiary center for all of Middle and South of Georgia. We have a level 1 trauma center and ICUs for neonatal, pediatric, critical care, surgical care, cardiothoracic, and medical patients. One of our newest facilities is a state-of-the-art pediatric hospital and health center, the Beverly Knight Olson Children's Hospital. Our Peyton Anderson Cancer Center specializes in outpatient oncology services, and the Heart Institute is where our cardiology unit supports a wide array of specialties, from electrophysiology to stents. Located in the West Tower is the Internal Medicine Resident Lounge, which has recently been renovated and provides comfortable and professional office space. Nearby in West 4 is our 14-bed ICU, by far the most demanding place where you'll spend your residency as you learn to take care of critical patients alongside attendings. The W.T. Anderson Health Clinic is where we have our outpatient continuity care and subspecialty clinics, serving adolescent, adult, and geriatric patients. You'll spend about 40% of your time at the W.T. Anderson Health Clinic. This is the bread and butter of our program, and you'll hone your skills in an outpatient setting and take care of patients, many of whom are uninsured, underinsured, with multiple comorbidities, and you'll help them reach their optimal health. Specialties here include hematology, oncology, cardiology, rheumatology, and much more. The Medical Education Building is where many of our scheduled learning opportunities take place, including our morning reports, morbidity and mortality, our once-a-week lectures, grand rounds, and our board reviews. You also get exposed to different research and clinical trials, and these will help you stay current on today's medical issues. The Peyton Anderson Health and Education Center is where we have our library, simulation lab, and conference centers, including the Eversol Auditorium and the Trice Conference Rooms. Classes at PAHEC are open to all residents, and these classes include ultrasound, airway lectures, central line, how to run codes, and how to treat arrhythmias. Residents also spend time in our sim lab using our simulation dummy to learn how to adapt to real-world situations. Off campus, we have our rehabilitation hospital and the Hope Center, where residents and fellows get to treat and care for patients at all stages of HIV and AIDS. We also serve geriatric patients at the Carl Vinson Veterans Administration Medical Center in Dublin, Georgia. I've wanted to be a doctor since I was a kid. When I did a rotation at Navicent in medical school, I got a great taste of what this program was. That is why I decided to apply to this program, and I'm glad I did. It's been a great experience and has given me confidence in taking care of patients. I feel like I'm prepared to go out in the world and do my best. It's also been great from a personal standpoint. We have a real bond amongst residents. We often play trivia, volleyball, and go out to eat. We have a great camaraderie. Let me introduce you to a few of the people on our team.
I am Patrick Kinsella.
My name is Alan Tyndall.
I'm Victoria Walker. I am internal medicine resident, year 2.
I've been in practice pretty close to 25 years.
I am from north of Atlanta in Cumming, Georgia.
Originally from Dublin, Georgia.
Savannah, Georgia.
Well, I can have a southern accent if I want to. We're going to be cutting some of this, right? Okay.
I was 18 years old when I realized that I wanted to be a doctor. I was in high school.
I initially started in engineering.
I was in 10th grade when I decided I wanted to be a doctor.
My biggest pet peeve
Is being mistaken for a nurse.
The residents will use the word laying when they really mean lying.
I can't really say there's one thing that really bothers me.
Word of advice I would give an intern is be a team player.
Just show up and try hard from day one.
And try to behave in a civil and respectful manner. Did I get the part?
You got it.
We look for residents who are able to suit up and study up for daily encounters. We are truly teammates here, and we are proud of our supportive and respectful training environment. Our residents have a willingness to learn continually and listen and incorporate feedback for self-improvement. Let me introduce you to a former chief resident and a current hospitalist with Navicent who has embodied this ethic so well over the last few years, Dr. Stephanie Beavers.
I really enjoy getting to work alongside the residents and the students. It's very exciting to see that person who's coming straight from medical school that's just very fresh and has a lot of knowledge but doesn't really know how to apply it to patient care become someone that is not only competent and confident in their clinical care of patients, but is also starting to develop their own style. My name is Stephanie Beavers. I'm an internal medicine faculty on the inpatient team in the resident continuity clinic. I think that the greatest strength of our clinical and academic environment is the collaboration. Each of our faculty has a very different personality, a very different style of teaching, but we're all working together toward the same common goal. Everything we do in patient care, whether you realize it or not, has a big interdisciplinary team behind it. So it's very important that you learn to value, respect, listen to, and work really well with all those members of the team. And so I like to share my thoughts and kind of talk through my thought process with the group and then get that input from them as well. I look for someone who is hardworking, who really values being a good team player, and who's just willing to listen and learn. Our program director always says he's looking for someone that's willing to show up, suit up, and listen up. And that's really it. Just doing those simple things will really get you a long way towards success.
Our dedicated faculty members and attendings continually set an excellent example for the rest of our team, and I could not be more proud to work with them. Our 2-year infectious disease fellowship program has its roots in our infectious disease division, which was established in 1985. Our ID fellows become the focal point of our educational activities and instrumental in running clinical services in the community. Fellows participate in ongoing research related to HIV and other areas of general infectious diseases, including COVID-19. Our fellows participate in outpatient clinics, including the local Ryan White HIV clinic, the Obstetrics High Risk Clinic, Pediatric Infectious Disease Clinics, and the Mercer Medicine Travel Clinic. I'd like to introduce you to one of our Infectious Disease Fellowship Directors, Dr. Rafael Ponce, to give you an overview of our fellowship program.
Hi, I'm Rafael Ponce, one of the infectious diseases physicians here at Navicent Health, and an assistant professor with Mercer University in Macon, Georgia. I'm glad to welcome you to our Infectious Diseases Fellowship Program, where we aspire to recruit the most inquisitive and passionate future infectious diseases clinicians and scientists. Here at Navicent Health, we are the referral center for the entire region, where we see an array of different infectious diseases from urban and rural settings. My area of research is the use of geographic information systems applied to infectious diseases, including parasitic infections in Brazil, as well as antiviral resistance gram-negative in our community. As an infectious diseases fellow, you will be instrumental in running the clinical services of our department. During your 2-year fellowship, you will spend 14 months on the ID inpatient consult service and 4 months in the outpatient service, as well as 1 month in the microbiology and pathology labs. You will also pursue research and educational endeavors during your fellowship and maintain a half-day clinic throughout your fellowship. Our infectious disease fellowship program will prepare you for a promising career as an infectious diseases clinician. Please feel free to reach to us directly if you have any questions. We look forward to meeting you soon. Now, let me introduce you to one of our fellows, Dr. Lauren Miller.
My name is Dr. Lauren Jersick Miller. I am a graduate of Trinity School of Medicine, current Chief Resident of Internal Medicine at Navicent Health, and Future Infectious Disease Fellow starting in January. I chose to be an internist because I have always had the desire to help people. It's so vast. There are so many different subspecialties that you can go into. You see so much different pathology. Sometimes there's just some cases that you just can't figure out. Then you get an aha moment and you get the right antibiotic, the right treatment, and then you see the patient getting better, and it's very rewarding. This is a great program here. All of the attendings are awesome. They give you just the amount of supervision that you need. You don't feel overwhelmed. You kind of have that freedom to become your own physician, make your own decisions for yourself. We do teach a lot with the Mercer medical students, and that has greatly enriched my learning. And if you're interested in any kind of research, Navicent and the labs have great opportunities for research here. If ID is something that you want to do, Navicent is a great place to do it at.
As you've heard, our internal medicine residency and our infectious disease fellowship programs are making a big difference in the community. And you'll join a family of smart, fun-loving residents, faculty, and staff. We hope you'll consider applying for our residency or fellowship program. Both will set you up for an exciting career in medicine or a rewarding subspecialty. Thanks for joining us today.
The internal medicine program at Navicent Health is a great place to start your career. You'll be equipped to take care of some of the sickest patients, and you'll be prepared to go out into the world and do your best. At the end of your 3 years of learning and practice with us, you'll be well-trained, extremely competent, and a confident internist. I hope this brief tour has clearly illustrated the wonderful opportunities at Navicent. Choosing where to complete your residency is an exciting decision. So on behalf of the faculty, staff, and residents, we wish you the best. And if you see me on campus in the future, please say hello. Oh, and by the way, if you do interview with us, don't ask Dr. Mathis to show you his dance moves. Some things are best left unseen.